Hi everyone, I am Dr. Tejasvi Borjalla, consultant doctor in Fidicus Homeopathy. In our last video, we discussed about the signs and symptoms of dengue and its risk factors for dengue and the treatment plans available for dengue. In today's video, we discussed about the investigations necessary for dengue, what are the precautions that we take for dengue, and also what happens if dengue is neglected. All are now discussed. I can explain this more clearly on the board. Let's move on to the board. Dengue is a mosquito-borne viral infection. It usually occurs in the rainy season. Dengue is spread by the Aedes aegypti mosquito. It usually starts with flu-like symptoms and leads to further complications like bleeding and shock. After knowing the signs and symptoms of dengue, causes and risk factors of dengue, now coming to the investigations of dengue. These tests are important to diagnose the dengue condition. These tests not only helps in diagnosing the dengue condition but also helps in monitoring the conditions like complications of dengue in bleeding conditions, shock conditions also. Early diagnosis is helpful in dengue prevention. Now let us know the investigations for dengue. First one is CBC, complete blood count. Complete blood count, platelet count decreases and also WBC count also decreases. Decrease in platelet count is a sign for dengue. NS1 antigen test. NS1 antigen test is done in early few days of fever, usually within the first 5 days of fever. It is the first test to detect dengue in early stage. Next is IgM or IgG antibodies. Presence of IgM antibodies indicate recent infection of dengue and presence of IgG antibodies indicate remote or secondary infection of dengue. Next, RT-PCR test. RT-PCR test is used to detect genetic nature of dengue virus. There are 4 serotypes in dengue virus. This test helps in detection of which serotype is affected. Liver function tests are done to detect any involvement in liver in dengue infection. Usually liver is the most infected organ in dengue fever and coagulation profile should be done. Coagulation profile should be done in the case of where bleeding tendencies in their body after getting infection of dengue. Next, tourniquet test. Tourniquet test is a simple bedside test to detect any fragility in the blood vessels. These tests are the investigation done for dengue fever. Now coming to the precautions for dengue condition. What are the precautions should be taken to prevent dengue? Usually dengue is a mosquito-borne viral infection. There is no antiviral treatment, so prevention is the best method. These are the precautions should be taken everyone. Do not allow water to stagnate. Usually mosquito breeds in stagnant water in water tanks, flower pots. So don't allow water to stagnate. Keep water tanks, drums and containers tightly covered. Don't open the containers and also water tanks. By keeping containers tightly, we can avoid mosquito laying eggs. Wearing long sleeved cloths, it means mosquito bites. Use mosquito nets while sleeping is one of the methods for prevention of dengue. Add mosquito larvicides in water tanks. Helps in the decrease in count of mosquitoes. Keep surroundings clean and dry. Helps to prevent mosquito laying eggs. These are the precautions should everyone take while preventing dengue. Now coming to what are the complications that will occur if dengue is neglected. Persistent high fever. Persistent high fever means there is sudden fever and also it doesn't subside. Severe abdominal pain. Severe abdominal pain is one of the complications of dengue. It means there is internal involvement of organs in dengue fever. Continuous vomiting and bleeding is one of the severe forms of dengue infection. Difficulty in breathing. Difficulty in the breathing in the sense of patient feel difficulty in breathing. It is due to bleeding and also accumulation of fluid in internal organs. Sudden drop in platelet count. There is sudden drop in platelet count. It leads to bleeding tendency. Low urine output. Low urine output, it means there is kidney involvement in the dengue fever. Black stools. Black stools, it means there is internal organ involvement occurs in dengue fever. It leads to bleeding tendency, causes black stools. Severe headache, eye pain and weakness is one of the signs for severity of the dengue fever. These are the conditions where we don't neglect dengue condition. If anyone is suffering from these symptoms, don't neglect. We can diagnose dengue at proper time and give proper treatment. We can save the life of dengue infected person. If you are suffering from dengue, Fidicus Homeopathy is the best option. What do you get from Fidicus Homeopathy means? In Fidicus Homeopathy, doctors are with passion, qualification, knowledge, experience, competence and compassion. We are following drug device procedures with high quality and we are also best in segment. We are providing medicines from best pharmaceutical industries. And we are also using latest technology in the treatment and also artificial intelligence for better treatment. If you are suffering from dengue, you want to get consultation in Fidicus Homeopathy. Fidicus Homeopathy provides 2 types of consultation options. One is online consultation, other one is in-person consultation. If you want to come by in-person, you can visit our nearest branch and get consultation Fidicus Homeopathy. If you are not available for in-person consultation, you want online consultation, we are providing audio consultation, video consultation. By using this, you can share your reports with us and doctors confirm the diagnosis. After completing the case taking, we will ship your medicines to your doorstep wherever you are in the world. If you are staying in India, it will take 3 to 4 business working days. If you are staying other than India, it will take 3 to 8 business working days. Now coming to how to get consultation Fidicus Homeopathy. This is our WhatsApp number 7997101303. By using this number, you can consult us. This is our website www.fidicus.com. If you have any doubts about Fidicus Homeopathy and if you have any doubts about dengue condition, you can visit our website. By using this website, you can also get consultation. If you are suffering from dengue, why Fidicus Homeopathy only? There are so many corporate hospitals, consultation hospitals are available. Why Fidicus Homeopathy means? Because Fidicus Homeopathy stands for highest chance of health. Fidicus Homeopathy following three main principles. One is highest success rate. In dengue condition, we are having highest success rate in treating dengue condition. And we are also providing transparent treatment. Transparent treatment in the sense we are maintaining transparency between the patient and the doctor in explaining the disease condition, prognosis of the disease condition, and we are also providing personal care. Personal care in the sense we are providing unique treatment for every person, and we are also clarify their doubts and myths about the disease condition. All these are the advantages in choosing Fidicus Homeopathy. If you want to stay safe from dengue, choose Fidicus Homeopathy. Fidicus Homeopathy also provide dengue preventive medicines. If you want to use dengue preventive medicines, consult Fidicus Homeopathy. I hope you understood clearly about the investigations for dengue, what are the precautions that we taken for dengue infection, and also what are the complications if dengue is neglected. All are now discussed. If early detection, proper management helps the person from dengue infection. We are also providing dengue prevention kit for kids and adults. If you want to use dengue preventive kit, consult Fidicus Homeopathy. Stay safe from dengue.
Fidicus Homeopathy.